Hello, my name is Brooke Musso, and I'm going to be showing you my first aid kit today. So I have all my stuff laid out, and I'm going to go ahead and show you my pack first. So this is what everything's going to go in. It's very handy because you can move it. These get tighter or they get longer, so your bag is various sizes. Also, in each one of the compartments and zippers, there are little compartments that you can put each thing in so that nothing falls out. I put a lot of stuff in this very front pocket. So first, we are going to get started with our Band-Aids. I have about 15 right here, various sizes. So here's a square one. Here is one. These are used for, bandages are pretty self-explanatory what you use them for, but this one you can be used like for your finger, for your toe, anything that it can wrap around. I have these circle ones, and I also have this big one. So I keep those in the very front pocket of my backpack. Next we have adhesive tape. So this is my adhesive tape. It's just a little roll. You can use it to secure a wrapping of any sort, and I just keep that in my front pocket as well. Next is my 4x4 dressings of gauze. I have a lot of these, definitely more than 10. They are Invacare, whatever brand that is, but they are 4x4 inches cotton dressings. They're all right here. And I just keep those in the very back of my backpack in this back little pocket right here. I slip them in here, and I keep them all right there. Next is our gauze rolls. So this, also these gauze pads can be used for any injury of any sort. You can put it on open injuries to saturate blood or any type of liquid, anything like that. And then these are just used to go over those gauze sponges that are 4x4s to secure them in place, and then you can simply tear that and tie it so that it stays in place. This is a 4-inch of roller gauze, and this is a 3-inch of roller gauze. So it just depends wherever the injury's at. Whatever's smaller, you can use a smaller one or the bigger one. And I just keep those in this little zipper pouch right here. All my rolls go right there. Next, we have antiseptic wipes, so all of these alcohol wipes, and these are just used for when you need to clean an instrument before you use it or clean the wound site before you use it. Alcohol wipes clean everything and disinfect everything, so there are those. I keep those in front with my Band-Aids because they are small and with the adhesive tape. Next, we have our instant ice packs. So these are going to be right here. This is a littler one, single use only for each of them. This one's still in the box, but it is definitely in there. For these, you just pop them and then shake them, and as soon as you shake them, they instantly get cold, and you can use them as an ice pack, a cold compress for anywhere that's hurt, your head, your shoulder, your knee, your chest, your leg, your back, anything you can use an ice pack for. These are single uses, but they work good. I keep them in the front of this backpack so that they don't get smushed and start getting cold, because once you activate it, you can't unactivate it or deactivate it. So I put it right there. Next, we have our scissors. So these are scissors, that are ones for cutting clothes. You can kind of see it with that tip right there that's a little bit longer than this one. These ones are used for cutting clothes and actually came in a first aid kit, so you can use these if you need to use an AED on somebody and need to cut their clothes off or off their chest so that you can put the pads there, or if you need to wrap their arm or wherever's injured, you can use these. And you can also use these if you need to cut the gauze to tie it, to make another bandage, anything. So very helpful. These also go in the front, so they are small. My next thing is a little pair of tweezers. Tweezers, you know how to use tweezers and what they're used for, but they can be helpful in this situation to get debris out of a cut, something out of an ear, out of a nose. tweezers are always good to have. They're in this little plastic container right now. I keep those in the front as well. The next thing that I have are some Ziploc bags. I just grabbed these from my kitchen. These are the gallon Ziploc bags. You can use these to put any personal items from the victim or from the patient in a Ziploc bag and send it with them. Or you can put your stuff that you've used in a plastic bag, even though you do have a trash bag, or I do have a trash bag in here. You can use these. They will come in handy. I'm sure of it. So I just put these in the very back in this little pocket back here with my 4x4 sponges. And next up we have my CPR mask. So we obviously have the ones that we got at school or in my first aid class that are in the red container that is in my backpack right here in here. And you just pop out the lid and start using it. Also, I have this one too. This one is just like a little shield over the face, but it has a little respirator air device so that you can breathe into it. You can see it right there, but that just goes over the face. And I just keep that with my other CPR mask that we were given in first aid. Those ones are definitely better because they seal over the face better, and they're more effective because they wrap over the head. But I keep those together in my backpack. The next thing that I have is a notebook and a Sharpie and a pen, and I just keep these normally in here, and my writing utensils up front. And that is just because you can write down allergies, medications, food, anything that the person or victim has had. And you can also write down when you put on a tourniquet, when you administered an EpiPen or other prescribed medications, anything like that. You can write down and then give it to the EMS people later, and you have it all because you wrote it down. So next we have our triangle bandage. I actually used this. I made this out of an old tea towel. So you can pretty much make it with anything. It is this triangle bandage like this. And you can use this as a sling. So this, the point will go towards the elbow, but you can use it and tie it on your neck, tie it on your back. Do it if somebody broke their clavicle even. You could use it, but that is a good sling. I keep this in here with my notebook in the same pocket. Next, we have a garbage bag. So this is my garbage bag. It's just a regular kitchen garbage bag. This is for if you need to send anything with the victim or the patient when they're going. If you need to have a garbage bag in case you need to throw anything away from the patient that happens to be bloody or have their fluids on it, you can throw it away. And it's just a good extra container in case you need it, just in case you need extra storage. So I keep this in this second little pocket right here, and I just put it right at the bottom. So the next thing that we have is a pack of matches. I have this full pack of matches. That's just to start a fire. I keep it in this front pocket. It's always good to have a fire starter just in case you were ever stranded in the woods or need to cook food, boil water, stay warm. You have those matches just to administer that energy. The next thing that I have are some safety pins. Oops, just dropped one. These can help because whenever you are tying something up, if you can't tie a knot, if you can't get a piece of clothing to go back together, a piece of an ace bandage to go back together, anything like that, you can just safety pin it. So I put these also in the front of my bag just because they are small. The next thing that we have is an ace bandage. So this ace bandage is wrapped up. It hasn't been used before and it's still in the plastic, but it is very helpful because it has these metal clasps. So instead of velcroing it or tucking it in, you can use these metal clasps to hook it together so that it's more secure when wrapping a wound, and it's tighter and it keeps everything all put together right where it's supposed to be. So I keep this with the rest of my rollers in here. The next thing after that is some gloves and a mask. So here are my gloves. They come in large, but there are 4 and they're nitrile gloves. So I'll show you that. They're still in the little package, and I just put that up front along with my package of masks. There are 10 in there because that's the first thing that you want to make sure when assessing a situation is that you are safe. So that means protecting yourself from airborne things, from liquids, from anything flying on you, going on you, affecting you in any way, and that is protecting yourself with gloves and masks. So I keep them together in the front pocket. Next we have hand sanitizer. So I have this spray kind. It's just normal hand sanitizer, but it's just a spray kind. So it's nice to have quick after you take off your gloves. You can do that, go to the next patient. Somebody else can use it if they need it. Very good to have. I keep it in the second, right in this little thing right here. The next thing that I have is an emergency space blanket. Emergency blanket. It's pretty big. There's only one in there, but you can see it all wrapped up in there. And this is just for shock. So you treat for shock whenever anybody hits their head, falls really hard, sees blood, sees bones sticking out for sure. Pretty much you can always treat for shock. There's no negative side effects for it. So that's what you would use there. This I keep in the second container with the hand sanitizer in this little compartment right here. My next thing that I have is this flashlight, and it looks like a pen light, so it's easy for the eyes to follow to and respond to, which is nice, and it does work. It is nice to have in case you can't see anything, also to follow response checks on patients. And I keep that up front too with my mask just in case. The next thing that I have is some low-dose aspirin. I actually use this for my dog, but it says low dose right there. And I just keep this up in the front. That can come in handy whenever, when anyone's ever in pain, you can use low-dose aspirin. So I just keep that up in the front as well. I have a yellow cloth here to signal if somebody were to be hurt. This is a bright color, so you can wave it, you can tie it on something, you can really use it in any type of way so that you can get some help. But it is a nice bright color, so it's always nice to have. I put that along with my trash bag because those two coincide. The next thing that I have is a poncho and small tarp. So this is my tarp, unmarked. This is my poncho. You can use these whenever it's raining. You can cover up the patient, the victim, whoever it is. You can cover them up, or if somebody's standing on the side of the road, they can use this poncho and keep their clothes dry. I keep that in the same area as the bandana and the space blanket, and I put them all right there. Obviously, I keep this little thing with me, and we got this in our class too. And it is just steps for first aid and CPR, just in case I ever need it. I know what I'm doing, and I know what steps to follow, and it's laminated just in case any fluids get on it. I keep that with my notebook. And that being the end of everything that we need in a first aid kit, I have some extra stuff that I want to go over really, really quick. So I have these little oval eye pads. They can help whenever anything is stuck in the eye, or you need to bandage an eye. It's a perfect size. You can use this and wrap it and tie it and keep it tight. You can also wrap it with this. This is also an extra thing. It's stretchy and it is like tape, but it doesn't stick to each other, so that you can secure a wrap of any sort. I have some Benadryl, and I also have these little sterile dressings that are different sizes, and these cotton tip applicators as well. And I just put all of these in my first aid kit in case I ever need it, and they all fit perfectly in this second little pocket. Thank you guys for watching.